And I've always found that statistics are interesting because my theory is you're either 100% or you're 0. No 70-30, 80-20. You're here, you're going to fight 100% until there's no more to fight for. That's been my take on it.
And I went to my first appointment after diagnosis with a list of questions, compliments of a medical professional who lives next door. So I asked my doctor, and what is the acceptable margin for resection? Meaning, how much clear tissue do you have to take along with the tumor to be sure that you have it all? And the answer was 2.5 centimeters or 1 inch, and my wrist was full. So I knew that I was going to lose my hand, but I actually asked Dennis closely. I said, what if I don't accept amputation? And he encouraged me to accept, to choose life without my left hand. And it's exactly what I did.
So when you started to frame it in those terms, somehow it started a process of feeling that, well, this can be manageable in some way. So how long did that process go through when you first were hearing about this till you started to feel it could be manageable? Was that days? Was that weeks? Was that months? Was that longer than that?
I can't remember exactly, but I grew up with a very close personal friend that had lost his hand in the Korean War. So I grew up with a neighbor that had a prosthetic hand. And mentally, to me, losing the hand, I knew I could go play baseball with my old neighbor, because he did. And I knew there was a lot of normal things that I could do one-handed. I just had to learn how to do it left-handed.
So that was helpful to have that other person as a model who knew that all those years that you knew him, that he would serve that role for you. That was really a helpful thing.
Yes. It was a comfort.
And I had the same experience. I immediately thought, okay, I'm going to get a prosthetic device. I'm going to have the best prosthetic device. I'm going to be able to do everything. I won't have to learn how to write again. I can do everything with this prosthesis, including getting manicures. And then I went and spoke to an occupational therapist who said, no. You will have to change dominance, and yes, a prosthetic device will help you if you choose to wear one, but you will have to relearn. And I think that focus gave my brain something to be occupied by, and then I had amazing group of friends and support, and I even had a neighbor who had a left-hand party for me, to say, farewell to arm party is what she called it, and so it was. I chose life.
And with a lower limb amputation, it's not everyday functioning; it's mobility. Can I go to a basketball game? Can I go to the park? How do I get my baby out of the crib? How do I get to the crib if they're crying in the middle of the night? Those are the things that I started to face. Those are the thoughts that I had when I was facing this, and I started to educate myself. What do they have available? What's out there? What has modern science come up with? And I saw that the new legs, I saw people walking down hills, walking up hills, walking down stairs, and you couldn't tell which person actually had the amputation. And the science that is involved in some of the new prosthetics is amazing. You can do everything you want to do. If you want to swim, you can get a prosthesis and swim, or swim without one. If you want to run, you can get a running leg, or I didn't run before, so I don't run now. But
I swim in circles now.
I've been at my current job now for about 8 months, and I don't think half the people know that I have a prosthetic leg. They know I have an interesting walk, but they might think I'm just cocky. But it's the things they have for lower limb amputees, they're pretty amazing right now.
Well, and when I met Steve, he was the second amputee that I met with, and both of them gave me the same advice, that with the right amount of patience and persistence, you really can accomplish anything that you want to do. But you have to want to do it. And so to decide, I got to decide how I added things back. I got to say, well, cooking is something that I really want to do, so I think that I'll, work on cooking right away. But first I had to learn how to write and how to cut and all of those other things. And so it's adding things back to your life in a progression. But it is a choice. And it's not easy. It's not easy.
Well, it's always struck me that when somebody has something that's important to them in life, and that sometimes we take it ourselves, our bodies, for granted so much we don't even realize how important an arm is. But if we have something that's important to us and then we lose it, we have to go through a period of mourning first, and there are all kinds of feelings of anger and all kinds of ways that we adapt and frustration. But then the task, psychologically, is how do we fill that void? If we just stay stuck with what we don't have, that's the problem. But then, like you were saying, we have to decide what we want, and we have to start filling things back in.
I might also add that not only does the patient have the mourning and emotions, so does your family and friends.
Did you each find that?
Well, I actually had a woman encourage me to get a prosthetic device that looked like a hand. And she said, "Oh, Ruth, aren't you going to want to, walk into a room somewhere and not have people know that you don't have a second hand?" And at the time that she asked me that, which was just after my surgery, I could honestly say to her, "No, I guess, I have to accept the fact that I only have one hand, and so I'm going to walk wherever I walk, and I'm going to have people look at me and say, 'Look at that woman, she only has one hand.'" Now, on the reverse side of that, I know when I'm having a grieving day, because my grieving day is, who wants to look at me? I only have one hand. Why should I subject these people to, and I haven't had one of these for a long time, but when I first started going to the gym to work out, I would think to myself, oh my gosh, everybody's going to look at me, and this is just terrible. I'm going to interrupt everybody. And then I would just stop and say, "This is a grieving day, Ruth. Just go through it. Just go through it and do it." There's
a process that you go through.